Michelle Lujan Grisham is running once again for a U.S. House seat from New Mexico's 1st congressional district. After losing to Martin Heinrich in 2008, Lujan Grisham ran for and won a seat on the Bernalillo County Commission. But she's back, aimed at Washington. And here's NMIF correspondent Sarah Gustavus.
Thanks for joining us today.
Thank you. Thanks to you and KNME. I'm delighted to be here.
Ms. Lujan Grisham, your background in healthcare has been an important part of your campaign. During the Obama administration, the federal healthcare overhaul passed, the Affordable Care Act, and I'm wondering if you were elected to Congress, what will you do, how will you vote to continue to support the Affordable Care Act?
Oh, I've been really clear during this campaign that I would never vote to repeal the Affordable Care Act. I think that it is very important and very productive legislation for New Mexicans. I do think as we're implementing, we have to be clear about its impact on our 50-plus businesses. There's been some recent reports about some negative impacts in the food industry in particular. And I want to make sure that we've got the right support to get folks navigating on these exchanges and to make sure that they're getting the credits and subsidies that they need. So I'm really going to be paying attention on the ground to how the Affordable Care Act's implemented. And then I would love to lead all of those improvements to make sure it's the most consumer protective environment for healthcare coverage that this country can provide.
Any proposals you've heard of so far of things that you see that need to be changed, any specifics that need to be adjusted?
You know, we have not talked about any specific proposals, but one thing that I've certainly said that in addition to making sure it's affecting people and it's being implemented properly, there are things that were left out. Like, for example, we did not change the way in which we negotiate for prescription drug prices. And the notion that Medicare can't leverage to get lower prescription drug costs, which saves Medicare so much money, I think makes no sense at all. And that's something that I'm definitely going to work to lead that change in the Affordable Care Act.
What if you're elected and President Obama doesn't win another term in office? Do you think that you'll be on the defensive trying to protect and keep the Affordable Care Act in place?
You know, it really depends on who's elected into Congress. And in this campaign, and also during the primary, folks really want a Congress that will work together, where you can reach across the aisle. We need to get the extreme ideas off the table, and we need to start practically working together to make sure that we're solving the problems of the constituents in our districts. And in Mexico, for health care, we have one of the highest uninsured rates, one of the highest uncompensated care problems in the country, one of the highest chronic disease. You name it, I can give you it's the highest. This is a place where I'm going to have to broker with many other members of Congress, both sides of the aisle, to make sure that we're getting quality, affordable access to health care in this state. And I'll do whatever it takes to make that happen.
What about other issues? Your background is in healthcare, but what about energy and other economic issues? How do you bring your experience in healthcare into that? Can you also apply the same skills to other issues?
Absolutely, and in fact, I've really worked hard to communicate that to voters. You know, even though healthcare and consumer protection got me into state government to be the voice for seniors and veterans and their families, I've worked on employment and small business growth at the county. I led the efforts for economic recovery and economic investment. We did Paseo, we did Lowe's, we did USC Bags, we did Friedman Recycling. I mean, every agenda was about what we were doing to invest in putting New Mexicans back to work. And we also launched a brand new partnership at the county where we're doing solar storage capacity in a partnership with PNM and smart technology in a partnership with some Japanese companies. I think that I've demonstrated probably the broadest efforts about meeting the needs of New Mexicans, probably of any candidate in the country.
In both the general and the primary election, your opponents have brought up the issue of Fort Bayard and management of Fort Bayard when you were in state government. What's been your response to those critiques of oversight of the Fort Bayard facility?
By making sure that folks have the facts correctly. You know, I was at Aging for 14 years, and one of my jobs was to shed light on the terrible problems in nursing homes. And I didn't have any authority to do anything about it, and I couldn't get anyone to take responsibility. So I went undercover. That certainly moved forward a much tighter agenda for nursing home oversight, but it wasn't enough. And I kept complaining, and in the Richardson administration went undercover again and exposed even new problems. And I was given then you should take responsibility. And I said I would. So even though I knew Fort Bayard was really in trouble, so were the other 6 facilities for the Department of Health. I took the job day one. I fired the administrator. I started reviewing every patient record myself. I wouldn't allow us to take any new residents. And finally, I got my nursing home administrator's license and took over the facility myself. And I was praised for an incredible turnaround by the Department of Justice. And now there's a $48 million brand new facility that's got one of the highest rankings in the state for nursing home care. So I'm very proud of that work. That's what I think government should do. Take responsibility for things that don't work and get them addressed.
Another issue that hasn't come up in the campaign as much but is important is immigration. New Mexico's a border state. Congress hasn't acted to pass immigration reform, so some other states like neighboring Arizona have put in place some state laws. Yet New Mexico has a driver's license policy that's unique, one of only 2 states in the nation that allows anyone to get a driver's license regardless of status. It's a controversial issue here in the state. What's your stance on the driver's license policy, even though it's a state issue and you're running for Congress?
I think it's an example that in New Mexico, we're struggling to figure out what we do about some of these issues between folks who are clearly residents and citizens and folks who may be undocumented workers. And we're all waiting for the federal government to do something, which tells me it is time today to do something about it. I mean, the driver's license issue for me, and I think that we're seeing that now in policy in the legislature, is it's a public safety issue. We need to right size in the state what we're doing about enforcement and fraudulent efforts to gain identification. And at the federal level, we need to make sure that we're investing in border security, but we're also dealing with the fact that we've got 12 million undocumented workers and families in this country today. There must be a pathway to legalization, and we must do something to support these kids. I love the DREAM Act because when I gave this example in the Sam Donaldson debate, when I was the Secretary of Health, a young woman in high school who turned 18 during her high school tenure was reported and picked up without any notice to her parents. Now, how frightening for this young girl, how devastating for this family. These are policies that are not keeping families together and are so regressive and inappropriate. We have to take the right steps.
Would you push for immigration reform if elected to Congress?
Oh, absolutely.
All right, New Mexico is also one of the poorest states in the nation. About 22% of folks here are living in poverty. What would you do in Washington, D.C. to represent the needs of these New Mexicans who face some of the greatest obstacles related to poverty?
There's so much that we need to do, and I think my public health background is going to be very useful. You know, all of the studies show that our health issues and our economic issues stem from our substance abuse issues and behavioral health issues are all from economic justice, that we must do something about solving poverty. And the most meaningful thing that Congress can do today is to pass the Jobs Act and put New Mexicans back to work, invest in infrastructure here. I mean, Paseo del Norte, that interchange, was so much about the environment and public safety and getting people back to and from work. But it was also getting the trades, getting people back to work immediately. We need to move folks into the middle class. We need to invest in education. We need to create a dynamic where we're very clear about these healthy outcomes, moving people out of poverty.
What about the federal government is already heavily invested in New Mexico. What about the role of the state government and the relationship between the two?
There's got to be a partnership. It's not just state government, it's also local government. You know, the notion that the feds take one action and the states do another and local government does another. I think if we and voters really want a Congress that works, they also want to see us have those right private, public, global partnerships, all designed to address these issues so we don't take any more steps backward. And I'm already concerned that state of New Mexico has not fully invested in the implementation of the Affordable Care Act. And as a Congresswoman, you know, one of my roles absolutely has to be that dynamic catalyst to get these partners to work more closely together.
What about some examples of successful partnerships? Have you seen anything that you think is a good example, something that would work that could be replicated?
I think that's really more about leadership. And I think that I've demonstrated that I've got those leadership skills. You know, I worked in a bipartisan fashion in the legislature and worked across the aisle at the county commission and have a small business today. You have to be willing to talk about ideas that you didn't think of. And I think that's part of it. You need to leave your own agenda and ego at the table, and you need to be clear about who it is that you work for. My priority is this community, and your ideas are meaningful. Let's find a way to marry those ideas. I think it's more about leadership.
The federal budget is going to continue to be an issue in the next Congress. What would you do if elected to Congress to resolve that impasse on the budget and get a budget passed?
We need a balanced budget. Again, it's about extremism. You know, the only budget that's gotten through the House is the Ryan budget, and this is a budget that's bad for New Mexico. It's a 10% loss to the labs. It guts Medicare and turns it into a voucher program. It minimizes Medicaid by making it a block grant. And if we don't do that, then the only other option on the table today is sequestration, which means a 10% across the board cut. And I can tell you, we can't take any more cuts at the labs. We can't lose Kirtland, and we certainly can't take any more cuts in public education. Balanced approach, bringing more revenue in, fairer tax policy, have the wealthiest of Americans pay their fair share. That gives you the opportunity to invest in the places that make sense.
Anything you would be willing to cut in the budget?
You know, listen, we've got so much waste and ineffective programs at the federal level. There's a lot that we need to do. But I would focus on the things that would give us a real return on our investment first. For example, let's go back to the pharmaceutical industry. The notion that we would disallow by not having a requirement in Medicare that you will get the lowest price for prescription drugs like we do in veterans doesn't make any sense to me. That's billions of dollars saved.
Michelle Lujan Grisham, thanks for joining us.
Thank you very much for having me.